Hi, welcome to another episode of Medicine Simplified. In this video, we will know how to calculate pediatric dose by age by using Young's rule. We all know that most of the pediatric doses are calculated by weight, but in some circumstances, we can't assess the weight of the patient. So, by using age, we can calculate pediatric dose. Young's rule is an equation used to calculate pediatric medication dosage based on patient age. It should be used when weight of the patient is unknown. It cannot be used for newborns and infants, that is below 2 years of age. It should be noted that Young's rule can serve as guide for dosing, but it is not accurate for predicting pediatric doses. Most accurate way is by weight. Now we will know how to calculate pediatric dose by using Young's rule formula. Just remember, we have to consider one-time adult dose of a drug, not maximum adult dose of drug. And formula is pediatric dose is equal to recommended adult dose into age by age plus 12. Let me show you an example. The adult dose of metrogyl is 400 mg and age of the patient is 60. Now we will calculate the pediatric dose. That is 400 into 6 by 6 plus 12. That is 400 into 6 by 18, which gives to 400 into 0.333, which is equal to 133.3, approx 134 milligrams. 134 milligrams is pediatric dose calculated based on age of the patient. If you like this video, please subscribe to our channel. Thank you.